Hello everyone, I'm Wendell Jones and welcome to this edition of the program Jones and Company. On this program, we examine the national issues of the Bahamas. The government of the Bahamas is working in various ministries to make a difference, as we know. And we have seen the government at work in the last week or so, working towards bringing restoration for the people in the islands affected by Hurricane Irma. And over the last several weeks since the new government change, we've sought to bring on our program Jones and Company a number of the new cabinet ministers of the Bahamas so that they can speak to the Bahamian people and express their views on various topics. And today on our program, we are pleased to have the Minister of Health, Dr. DrSands, and he has been with us on radio for many years, and this is a wonderful opportunity to welcome him here on Jones and Company as the Minister of Health.
Thank you, Mr. Jones.
You, nice to see you.
Good to be here.
Godfrey Ines?
Thank you, Dr. Sands. You know, as a regular on the Quick News Morning Show, we miss you.
I miss that opportunity.
Yes. Yes.
You know, there have been some sacrifices, and that is absolutely one of them that I miss quite a bit, but we move on.
Yeah. Yes, you know, we've had a number of calls from our listeners about your participation, but you've moved to bigger and better things.
Well, let's say we're in a different vineyard.
Yeah.
And there are different challenges. I sometimes, as I get a minute to reflect on these last 4 months, you think, a lot has happened. It has been a very interesting time. I don't know whether that's in the definition that the Chinese use, may you live in interesting times. Mm-hmm. But it has certainly been challenging. It has been rewarding in the sense of being able to make a contribution.
You've been a physician for many years now, and I'm sure there are some of your patients who wish you had remained in your office and not Minister of Health. And, even before the last campaign, you would have heard, well, Dr. Sands is such a good surgeon, such a good physician, he should be in the hospital. How are you enjoying being Minister of Health?
Well, in many ways, what I do is very similar to my role as a surgeon, and people find that peculiar that I would say that. Many people think that my skill lies in my hands. Indeed, my skill lies really in my head. The thoughts are executed with the use of my hands. So tackling the problems that health require some of the same decision making that I would use as a surgeon. That said, virtually every day I get a call from somebody that wants to know why I'm still fooling around with this politics thing and when am I going to find my senses and get back to my real job. And there have been some challenges, I admit, with the delivery of particular services, particularly vascular surgery, just because we have a limited number of surgeons in country that do what I do or do what I did. I still operated the Rand Memorial Hospital. I try to do it 1 day a month. That decompresses the demand on the Princess Margaret Hospital, and it allows my partner to at least talk to me now, because he don't particularly like me anymore. Because much of not that he liked me before, but, but a lot of the load has been transferred to his shoulders. And until we can actually get that replacement on the ground and actively engaged, I recognize that there has been an opportunity cost that cannot be minimized. Mm-hmm. It is real. Despite that, I think we have to remain focused and try to solve some problems. And it reminds me of the need to be productive. It reminds me of the need to ensure that there are some results. So at the end of the day, when this era is evaluated, people will say that this was not just some fiat, it wasn't just some whim, but that there was benefit that came to the Bahamian people because of that choice.
How do you, Minister, deal with the issue of being a policymaker on one hand and a professional on the other hand?
That's a steep learning curve because it is very tempting to want to remain the technocrat or the technical expert. And you can get yourself in trouble because you would read a report and you may have your own opinion about the veracity of that report or the accuracy of the decision making that arose from that report. But I'm learning. I'm trying to stay in my lane, you know, and remember, I just got a new permanent secretary, probably 2.5 weeks now.
I know, well, she worked with me in agriculture.
Very dynamic person, and I think that health now has an opportunity to really get up to speed.
There are some people, Dr. Sands, who believe that a medical doctor should not be the Minister of Health, that it's probably best to have a businessman who will listen to the health professionals, to the doctors and to the technocrats, and he would make a decision. How do you feel, and Gottfried talked about the policy and your being a medical doctor, do you feel conflicted in any way?
No, I mean, if you look historically at the ministers of health in the Bahamas, we've had it on both ways. We had Milo Butler, we had Charles Carter, we had Teresa Moxie, I don't think she was Ingram at that time, we had Ronnie Knowles. Right. We've had doctors and we've had businessmen.
Norman Gay.
I think it's an individual thing. It's really how well do you understand your function and how well are you guided by the principles that say that the minister ought not be an administrator.
Yeah.
Because when you get down in the mud, get down in the weeds, I think you get in trouble.
The minister is responsible for policy.
And I think that overarching conceptual approach as opposed to minutia, managing minutia, allows for things to be done reasonably efficiently because you have to collate a whole lot of information, help to steer your people in a particular direction, and also try to unite a whole lot of forces. I have a number of technical people working in health. Many of them are very talented. Unfortunately, what I met was that they weren't all swimming in the same direction. So a program going on here that didn't relate to a program over here, and so on.
So it has to do with management.
It has to do with management. It has to do with defining a vision and ultimately having that translate into benefit for the average Bahamian. So if you were to ask me, what is the measurable indicator that says that we are successful? That measurable indicator is the perception of quality felt by Mrs. Brown when she comes into the emergency room with her sick child, or with her Grammy, or with her auntie. I have defined, and I believe this to be true, ground zero as the emergency room at Princess Margaret Hospital. That, whether you like it or not, people look at PMH as ground zero for healthcare, okay? And how well or how poorly they are treated, what they experience, how it progresses, gives people this gut perception of the overall quality of healthcare, okay? Now, the truth of the matter is that when you get to PMH, the likelihood is that our primary healthcare system has probably failed. You know, if you get shot, that's not true. If you have appendicitis, that's probably not true. But we ought to be providing the majority of our health care out in the community. Primary care, preventative medicine. So even as we seek to improve what happens in that emergency room, we ought to be making the need to go to the emergency room less and less relevant to the ordinary Bahamian. So that means that the Elizabeth Estates Clinic and Fleming Street and Flamingo Gardens, and then all of the community clinics throughout the Bahamas need to be brought up to a particular standard.
Yeah, you are responsible for the state of the infrastructure as well. And I made the comment on a radio program that I went to PMH with Godfrey the other day to see a colleague. And I was appalled.
You should be. We should all be collectively appalled at what we have accepted as adequate. This is the premier institution, healthcare institution in our country. And yet we have accepted that this rundown entity is good enough for our people. And so as you walk through the halls and you look to the right and you look to the left and you say, surely we're better than this. Now, let's say that you bring your uncle, your grandfather, to the emergency room. And there he is placed amongst 50, 60, 70 other people. 2 bathrooms. If he wants to relieve himself, okay, for the entire area. Let's say that he is found to have a medical problem, but there are no beds in the hospital, and so he might have to wait 2 or 3 or 4 days in a hallway on a trolley. Surely we're better than that. Now, I've heard people say, look, Sands, you've been here 4 months, how come you ain't fixed it yet? Okay? And that's reasonable criticism, I guess. We are defining the path to solve that problem. But certainly I think we have to undergird all of the decisions with a fundamental love and concern for the dignity of the ordinary Bahamian who can't afford to go to that really nice place across the street, okay? Or to fly to South Florida. And the issue of safety, the issue of comfort, the issue of quality ought to be what defines the experience that people have in all of our health facilities. When they leave that emergency room and they go on the ward, that they feel safe, that they feel that people care about them, that they are competent individuals providing their nursing care and their medical care, who actually are going to take the time to speak to the family, explain what's happening to their loved one, okay? All of these things are basic principles that we seem to have lost over a period of many years. And we've got to recreate the environment where when somebody winds up in hospital, when I walk out that front door, I say, boy, okay, be safe.
Do you see the capacity to really manage the Princess Margaret Hospital for what it should be? We run an airport, a private company has been contracted to run our airport, and people are happy with it. There are suggestions of private-public partnerships. Do we need that kind of arrangement as exists at the airport for PMH to run successfully and efficiently?
Let me say, before I answer your question, that as I speak representing the collective views of my colleagues. Mm-hmm. And so when we look at the approach to the airport, it was the political will to do better, okay? We had LPIA, it was a rundown, disgraceful thing. The bathrooms would stink and dirty. The water didn't run many times. The parking lot, the arm didn't work. The person who was tending to the checkout would have to run back and forth sometime in the rain. And a decision was made. Look, let us move this thing to a different level. And how did they start? They started with the bathrooms. They cleaned up the floor, they put lights in, and they put new bathrooms. You remember that?
Yeah.
That was the first step. And all of a sudden, you had a different experience at the airport. And then in a phased way, we improved it. To answer your question specifically, while privatization might be an option, I think it is simply the political will and the professional will and drive to move our healthcare facilities, all of them, to a different standard. We have just simply not felt it was necessary. We've accepted mediocre for too long. And I've worked there for 23 years. So I can tell you that at every step along the way, I can give you an idea of some of the battles that have taken place to move the hospitals along. Many of the clinicians that work there are dedicated. Many of them are frustrated. I would have gotten a WhatsApp message today from one of the senior physicians, annoyed, I could use a stronger term, at the fact that her patients didn't seem to be getting the medication and the therapy that had been ordered. Immediately, we said, okay, let's look at the root cause of this problem, convened a special team to look at this thing. This is today, to identify from procurement to administration why things were not happening the way they should have. There is historic issues, that legacy issues that have to be just thrown away. And I don't for 1 minute suggest that it's going to be something that we can just do by click of a finger, okay? We've got some human resources issues. We've got some funding issues. We've got some cultural issues. Some of our people simply believe this is the way it ought to be. And I think you find that across the public service, right? You see somebody who looks like you come in, and as far as I'm concerned, they don't deserve good service.
Do them a favor.
You know, suck my teeth, man. I talking to my girlfriend or my boyfriend. Okay, so wait. There are also some other deeply entrenched issues, and that is that healthcare is free, the belief that healthcare is free. Now, we have promoted that politically. And anytime you remind people that there are gazetted fees for services, and I can't afford to pay that. So when a fella as wonderfully coiffed as Wendell Jones walks in, I was going to say Godfrey, but Godfrey, you maybe already talked with Godfrey Socks. So, and just on that initial evaluation, you believe that that person could probably afford that $10 that you're going to charge for a particular service. But they'll say, nope, I ain't got it. And we have historically just let it go. So when you now deliver $200 million worth of health care and you collect 11 or 12 million, then people wonder, why is a CAT scanner not working? Why do you not have an extra ultrasound? Why is this happening? It's a very simple thing.
You can't afford it.
You can't afford it.
Dr. Sands, you are a Johns Hopkins graduate, right? I know you know the medical system in the U.S. I also believe you know the Cuban system. What model are you going to propose for the Bahamas?
That's a very, very important and insightful question. I think a uniquely Bahamian model is the model that's going to work here, but one that draws from some of the best of
both worlds,
all of those, all of the systems. So we now have an opportunity to look at the benefits of choice in the United States, but the problem of cost and excessive litigation that plagues services in the United States. In Cuba, just as an example, you have availability,
yeah.
but you have very little advanced technology. And so when you and that may change as Cuba opens up. But there are some benefits to newer technologies in terms of patient outcomes, in terms of lengths of stay, sizes of incisions, the trauma of delivery of healthcare. Now, interestingly, Cuba has kind of hopscotched around some of the advances in the United States. For instance, in some of the oncology or cancer care, they are even ahead of the United States, particularly in terms of their approach to lung cancer. Whether or not some of those things can be imported to the Bahamas. So interestingly, we find ourselves benefiting from some first world approaches and suffering because we have adopted some of the first world approaches. But the one truth is that we have not adequately provided primary care services in a way that meets the needs of our people. If you look just in terms of the numbers of primary care physicians, it's estimated that we are about 115 general practitioners short, or primary care physicians short, right now. In order to provide a doctor in, let's say, Abrahams Bay, or provide a doctor in, well, unfortunately, Salina Point is now in a rough shape, but let's pick a community. It makes sense if you have a well-trained, competent, compassionate, capable physician in every community that you're hoping to see grow. We only produce about 6 or 7 family practitioners per year. And so if you have a deficit of 115 now, at that clip, or even a little bit more, it'll be 20 years before we can adequately put a Bahamian doctor in many of these communities. That's not fast enough.
Yeah. We're on the program Jones and Company. Our guest on the program today is the Minister of Health, Dr. DrSands. We'll come right back.